So, thank you very much for coming today, and thank you for agreeing to share your experience after the operation that you had by me and by another surgeon. So, you had the carpal tunnel first, and I want to know what sort of problems you had before that first operation, when you had the carpal tunnel done for the first time.
Well, obviously there was quite a lot of pain there, and a numb sensation in the three of the fingers here, which were the ones mainly affected. And my ability to grip things was seriously limited. So there's pain and an inability to grip things. So that affected everyday life. And it's also important to me, it affected my professional career, which is as a percussionist, playing with orchestras and big bands. And so it was very limiting and quite depressing, actually.
So, and how was the first operation which you had? It was done with a local anaesthetic by another surgeon?
A local anaesthetic, that's right. And I was aware, I was conscious as well at the procedure where I was aware of everything. There was a certain amount of pain during the operation, to be honest. I can remember that quite vividly. But afterwards, the pain level changed slightly. It increased. The numbness was still there, and there was no real improvement at all. In fact, that was probably more painful than before the operation.
More painful before the operation?
Absolutely, yes.
And then you waited for a few months. That's when you came to see me.
Well, that's right. We pursued the possibility with the surgeon at the time, and we really weren't getting too far. And so I then sought your opinion on the situation and the prospects for some improvement.
Yes, and so we did some more tests, and we found that the nerve is very likely not to have been completely released. And we did the second operation.
That's right. Yeah.
Which was slightly bigger, and you remember we did the anaesthetic when we just gave you an injection in the armpit.
Indeed,
that froze the whole arm, so you didn't feel much. So I know that how serious about your drumming, so I want to come to that very specifically, but in general, how was your recovery after that second operation?
Well, immediately there was relief from the pain. Really the pain level wasn't there at all. What I did have, and I understood it was a period of time before sensation would come back. So I didn't immediately have all of the sensation back in those three fingers, but very quickly the index finger recovered. That was the first to recover.
How long did it take for
and that took a few months. You warned me about being patient, yes. and certainly that was the case. But yeah, the index finger was the first digit to recover, and that's recovered fully, followed by the thumb, which is now fully recovered, and there's just a slight sensation in the tip of the middle finger. But in terms of movement and the ability to perform my percussion work is, fortunately, I'm very pleased to say that I'm back doing the same amount of work as I did before.
I'm so delighted to hear that. And now I forgot to say that we are now a year since the operation.
We are indeed. So yes.
And there's still a little bit of numbness in your middle.
Yeah.
But I think this is going to come back, and you're going to have a completely back your normal hand back. And so tell me what's so special about drumming, because you...
well, what's so special is
percussion.
Yeah, if I may.
You need to do a lot of practicing, and you need to do a lot of concerts. So.
We have to, yes, there's a certain amount of flexibility that you need to keep exercising in the fingers. The finger work is very important, particularly it's not a question of just gripping like that. It's a question if you have to move the stick in that way, so the fingers and the ability to move those fingers, to have sensation and to be able to feel the grip.
It's not only the power, you need to have the feedback.
You have to have the feedback as well, and I can just demonstrate that on this pad here, that as you can see, it's not quite the ideal, but you can see So there's a lot of work there in the fingers, and I really was seriously hampered before the successful operation. I really wasn't able to feel any sensation, any movement in that stick at all, in which case it seriously affected my playing capability. Happy to say that's virtually back to square one.
I'm very happy to hear that. So thank you for sharing your experience.
My pleasure.
And this is the very last time we are meeting, so all best of luck.
Thank you very much.
Hope you don't need me anymore, okay?
Indeed, yes, thank you.
Thank you very much.